Good morning, everyone, and welcome to the PHLCVB's fourth COVID update webinar. As most of you know, the PHLCVB has a long history of utilizing the amazing health professionals and resources of our region to help attract meetings and conventions to our destination. Our PHL Life Sciences Division was started over 30 years ago for that sole purpose and is today comprised of 50 advisory board members from our local healthcare industry and its executive director, Bonnie Grant, who has led our efforts in this area for the past 13 years. When COVID-19 was progressing in the spring of 2019, Bonnie established a 20-member subcommittee as a resource to help the PHLCVB relay information and share resources with our clients, members, and local partners. Once we realized the enormity of information that was coming out of the pandemic and how hard it was to decipher and understand, we felt the need to partner with someone in the local healthcare industry that could serve as an external voice to our customers. And to support this effort, we partnered with Dr. David Nash, Dean Emeritus of the Jefferson College of Population Health, as the PHLCVB's Chief Health Advisor. Dr. Nash is an endowed chair professor of health policy at the Jefferson College of Population Health, where he served for more than a decade as the founding dean, culminating in a 30-year tenure. In addition, just last month, the publication Meetings Today, which I'm sure many of you are followers of, recognized the PHLCVB's efforts during the pandemic in educating customers and customer outreach by naming Dr. Nash one of the top 10 trendsetters for 2021. We've utilized Dr. Nash's partnership with client interaction with our customer advisory board, and most publicly in these quarterly webinars to help educate our stakeholders and also highlight our great life sciences foundation here in Philadelphia. Partnering with us again on this webinar is Dr. Leonard Friedland, who has played an instrumental role this past year as a member of our life sciences board. Dr. Friedland is the Vice President and Director of Scientific Affairs and Public Health for GSK Vaccines. At GSK, Dr. Friedland is involved in the development of vaccines for use in children, adolescents, adults, the elderly, and pregnancy, including vaccines for the prevention of flu, meningitis, whooping cough, rotavirus, hepatitis, measles, RSV, and shingles. He is privileged to be GSK's medical and public health representative and spokesperson for U.S. vaccine topics at the CDC, other public health venues, world congresses, and media outlets. Prior to his work at GSK, Dr. Friedland was the division chief of pediatric emergency medicine here at Temple University School of Medicine. He studied medicine at Mount Sinai School of Medicine in New York, has published more than 50 peer-reviewed articles during his career and many book chapters on healthcare and vaccination topics. And once again, I'm Kavin Schieferdecker, Senior Vice President of the PHLCVB's Convention Division, and very fortunate to be moderating another webinar with these great partners. Before we get started, I do need to state that this webinar is meant to serve as an informative discussion based on the doctor's knowledge and experience. As always, please refer to the guidance offered to you by your organization, the CDC, state and local organizations for your events over the next few years. Also, please note that the chat feature is not available, but you can add questions to the Q&A section, and we'll do our best to get them incorporated into the discussion. So welcome, gentlemen. And once again, I'm starting off by saying a heck of a lot has changed since our last webinar. And with so much news to cover, I'm going to delve right in. Let me start by saying it seems that Philadelphia is doing a better job than many other areas of the country in terms of the vaccine distribution, infection rates, hospitalizations, and deaths, which are still high in some parts of the country. Some recent stats on Philadelphia, we're proud to say our vaccination rate, we've got 84.1% of people have at least one dose, and 69% are fully vaccinated. Over 1 million people have been vaccinated in Philadelphia with at least one dose. And then the city has also mandated that all healthcare workers must be vaccinated by October 15th. So some big stakes in the game in terms of leading the charge. Dr. Nash, let me get started with you. So Philadelphia seems to be doing far better than many other markets. Why are we still seeing portions of our country struggling with COVID?
Well, first of all, good morning. And Kavin, thanks again. And special thanks to my partner, Len Friedland. What an awesome guy. Great to be back with you and all of the folks who care so much about Philadelphia, about our convention center, and about visiting our amazing city. You are right, Kavin. A lot has happened since the last time we were all together. It's just every day. And, guys like Len and me, we're waist deep in this every single day. And there's still so much information. I know we both feel sometimes like we're drowning ourselves. So how everybody else keeps up, it's a big job. So look, we are a medical education and healthcare town, right? So we've got 5 medical schools, including the one that I'm standing next to downtown at Jefferson. We produce 1/4 of the nation's physicians train in our great city. So we're on top of things. That's the good news. But we're facing the same challenges, maybe on a smaller scale than lots of other markets. So look, here's the punchline. We have such a heterogeneous country, such a big country. And the vaccination rate from county to county, even from zip code to zip code, has such variability that is one of our key challenges. And wherever there are pockets of unvaccinated folks, especially folks 65 and over, we put everybody else at risk. Where there are unvaccinated kids 12 and over, they put everybody else at risk. So the biggest challenge we have is heterogeneity, which is a fancy way of saying we're a big country. People do what they're going to do, zip code to zip code, county to county. That is still one of our biggest challenges. So Kavin, I think for our listeners and the amazing audience that you've accrued here today, and great to be back with everybody, the most important thing these organizations can do, beside coming to Philadelphia to hold their convention, is to get everybody vaccinated in their own organization and to mandate it. We've got all the legal power now. The precedents have all been set. The president himself got the booster shot. I'm sure you've all seen that. Let's get everybody who can be vaccinated. That's our number 1, 2, and 3 goal. If we could do that, boy, we'd be back in business. So I think that's the take-home message from me, in addition to the message that I'm sure Len will reinforce. This variability, this variation from county to county is really a challenge for our country. And when you look at countries like the United Kingdom and Norway and elsewhere, they don't have that kind of variation. And of course, they're much smaller countries, much less heterogeneous. But if we could sort of smooth this out and get everybody vaccinated, boy, that's the key to the mystery here more than anything else.
Yeah, just to add to that, Kavin, just to say that what we're experiencing now is the pandemic of the unvaccinated.
Indeed.
And that's really the target.
And on that note, Dr. Friedland, you shared an article with us last week from The Atlantic. And I want to share a quick quote from that article, which compares us to the UK. One of the quotes was, the difference between the UK and the US isn't just that fewer Americans are vaccinated, it's that fewer of the most vulnerable Americans are vaccinated, and they tend to cluster together, to David's earlier point. Exactly. So based on that, how much of a factor is having a high vaccinated rate matter when it comes to the size of any particular gathering or meeting, whether it be a family gathering, a sporting event, or a business event?
Oh, it's absolutely critical. The virus will find people who are vulnerable for infection. And if we can keep our clusters in a way where that virus can't infect because it has nowhere to go, then it can't cause infection, disease, and it won't be spread among that community and committee, an organization. And so when we're looking to large groups coming together, or even small groups coming together, as you mentioned, the more people are vaccinated, the better, especially because there will always be people who are vulnerable, be it that the vaccine didn't take. No vaccine is 100% effective. There's never been a vaccine that's 100% effective that will last forever. So there will always be vulnerable people within our gatherings. And the more that we can provide protection around those people, the better. And that's why it's so critical as we have gatherings again here in Philadelphia and across the country, that we make sure that everybody is vaccinated and providing the best protection. I'm really thrilled about what's happening here in Philadelphia. As I've been walking around the last few weeks and going places, everybody is masked up as you go indoors. And that's different than in other cities that I visited recently. In Philadelphia, people are masked up when you go indoors, so that's great. People are careful about keeping their distance as well, and of course, washing our hands. But the most critical thing is vaccination, and it's critical for these gatherings, be they small or large, because there'll always be vulnerable people, or we could be vulnerable ourselves, and we don't want to get spread from somebody else. So vaccination is the key.
We were happy to just last week host our largest event we've had in 18 months since the pandemic started. It was an event called Natural Products Expo East. They were expecting about 30,000 attendees when they initially committed to Philadelphia a few years ago, but we were thrilled as a community to see 15,000 people come through. They were a great partner. They put in an extremely thorough safety plan with amazing protocols. They required vaccination or testing before they came. And walking into the exhibit hall last week, I rarely saw anybody with a mask below their nose. They did a fantastic job. They had great people execute on their staff, walking around ensuring people had masks up. So they did a lot of great things. That event was great to see. The fact that we can do events like that with the right protocols by coming to cities with the right protocols in place in terms of safety, coming to hotels like we have in the city that have amazing standards in terms of brands or management companies that are doing things. So it's good to see that they can be done. I haven't heard the term super spreader events in a while. Talk to us about that.
Well, I'll go first on that one. Yeah, thank goodness you haven't heard about a super spreader event. And I was sort of holding my breath last weekend and the weekend before when the NFL reopened and we had 60,000 plus screaming Philadelphia Eagles fans in our stadium last weekend for opening day. So far, fingers crossed, so good. It's to Len's point and my point. We have a high percentage of the population who are vaccinated. Look, we're dealing with a wily dog virus here. It's going to find you. If you're not vaccinated, COVID is going to find you because it's going to preferentially try to find somebody who's not vaccinated. And this is all about still the pandemic of the unvaccinated, just an incredible situation. As far as that great meeting, Kavin, I think kudos to that team. They really did the right thing. The testing, the certification that you've been vaccinated. And I think, folks walking around saying, please put your mask on correctly, really important. Speaking personally, I've started to ride our local mass transit now. Masks are required. I was really impressed. Every conductor not only has on a mask, but a face shield, because think about their day. They're seeing hundreds of people every day face to face checking tickets. So I was really impressed with how well behaved everybody was on the local train. I've been on Amtrak in the last few weeks. Everybody had on a mask. I've been on 2 airplanes. Everybody had on a mask and there was no fighting, thank goodness. So, when people behave like grownups, like I hope we all are, and we get vaccinated and we wear a mask, there should not be a super spreader event, quite frankly. There really ought not to be. And I think luckily we're seeing that so far. Again, big risk area are the schools, especially school age kids under 12, not vaccinated. Listen, my 2-year-old grandson wears a mask to preschool. If he can do it, anybody can do it.
Yeah, I'll add to that, Kevin. We can safely here as a country have large events with the proper protocols in place and with the attendees being vaccinated. If we look to what's happening in our hospitals across the United States, more than 95%, if not even 99% of people hospitalized are unvaccinated. The vaccines are doing what they were designed to do, and that's to prevent hospitalizations, ending up in the ICU and dying. The vaccines are holding up to do that, but the people who are unvaccinated are vulnerable and they are still getting very, very sick. And that includes children under the age of 12. I read this morning, 27% of people hospitalized with COVID right now in the United States are children. Almost 1 in 4 are children who are hospitalized. And so that's why it's so important as well, because the vaccines are designed to prevent death and ending up in the ICU. But people will get infected. There will be people who have mild cases. They might not even recognize it, but they will transmit it. And so if you pick up a case of COVID because you're in a group setting, and then you bring it home to your child who's under 12, who today still cannot be vaccinated, or other vulnerable people in your community or your coworkers, they can get very sick, especially if they've not been vaccinated. And so that's why vaccination is so important. But we can do this safely. We're seeing how we can doing it. We're doing it here in Philadelphia, but we have to be smart about it and not only think about ourselves, but think about our community and protection of everybody around us. But we can do it. It's already happening. We just need to keep at it.
Dr. Nash, moving to testing, you talked about the need for rapid testing, I believe on our very first webinar over a year ago.
Yes.
Some countries are doing it very well. What's keeping the United States from adapting a more robust rapid testing model?
Well, gosh, Kavin, this is like the third rail aspect of the pandemic, right? So more than a year ago, really great folks at Harvard Medical School and elsewhere were writing about and talking and putting editorials in the Wall Street Journal. I am still convinced that we could have crushed this a year ago with more massive and pooled testing all the time. Companies finally got through the FDA approval process. We finally have several very well-regarded, high sensitivity and specificity, easy to do at-home tests. Now you can't get them for all kinds of supply chain and other not so great reasons. And I'm not going to disparage any companies, but look, everybody knows back in June and July, when things looked so rosy, major suppliers said, well, we don't need to keep pumping out these tests. Let's shut down. And then Delta happened, and here we are. So we're 4 to 6 weeks behind the demand curve for easy at-home testing. I've encouraged everybody I know, go online, get some home tests, have them available. It's easy to do, high sensitivity and specificity, not very expensive. The challenge today is finding these tests. So that's the home situation. But let me tackle the meeting situation. Once again, we have to think about this kind of like slices of Swiss cheese. Just picture slices of Swiss cheese. And what we want to do is have the first slice of protection is the vaccine. The second slice is wearing a mask. The third slice is social distancing. The fourth slice is get a test and don't go out and don't go anywhere if the test is positive. What we want to do is prevent all those Swiss cheese slices from lining up and you put a pencil through all the holes and boom, you get COVID. So every slice of Swiss cheese, it's a great visual, is another layer of protection. So I'm all in favor of, you've got a vaccine, fantastic, come to our meeting. But guess what? We're also going to give some rapid antigen tests because we want to give another layer, another slice of protection. Let me tell you a story. I had the privilege of going to a gala to support families and make donations with regard to 9/11. So my wife and I flew up to a beautiful hotel in Maine, and everybody there had to be vaccinated, and they did on-site testing, and we could talk about what kind and which company. I'm not endorsing any single product for sure, but a reputable company did on-site testing of a fully vaccinated 175-person gala event for a great cause. And by the way, Katie Couric was the mistress of ceremonies, so it was extra special. Well, 5 people, totally asymptomatic, fully vaccinated, tested positive. They retested everybody. 1 got a pass and was able, but 4 folks who came all that way, made a donation, were not allowed in the ballroom. They were incredulous that they were positive. So that's 3% of those attendees. So look, I'm all about vaccinate, vaccinate, vaccinate. If you have the resources and you could add another slice of Swiss cheese, another layer of protection, my wife and I are grateful that those 4 people, unbelievable, traveled wrote a big check to go to this gala. They did not attend. And we felt much safer knowing that that extra level of protection had been levied on this crowd. Is this for everybody? I get it. Maybe not. For 4,000 people, that'd be a pretty expensive undertaking. But for 175 folks, it gave people an incredible level of confidence and peace of mind to attend the event. One story, I get it, but I think it's telling. What we really want to say is multiple layers of protection. That's what we're shooting for.
So moving that to a macro level, it's a great story. I mean, it's specific, and I'm certainly back at the Swiss cheese analogy. Amazing. I think that's something we can all take back to that one friend or those couple friends or family members we all seem to have that are still not quite on board with everything.
Yes.
It's a pretty simple story. But moving this to a macro level, should our event organizers on the webinar be prepared to have rapid testing as part of their meetings and events moving forward for the next couple of years, do you think?
Well, my personal view of this, after my review of all the literature, we wrote a piece about this in the peer-reviewed literature called a testing testimonial. My assessment is that the answer to that question is yes. Be prepared. Is it mandatory? Probably not. Would I like to go to a meeting where I knew everybody was vaccinated and tested? You bet. And I think that would be a tremendously positive turn of events. So look, testing is on the horizon and is going to be with us for months. And I think all the modeling, and Len knows a lot more about this, you know, some of the news looks pretty good. If we could get the vaccine approved for kids under 12, as Len was alluding to, you know, maybe March, April of next year, we could really turn the corner. I'm hoping, but I think testing would add a lot of peace of mind right now. We don't have to wait till March or April of next year.
And
On a related, I'm sorry, Len, go ahead.
yeah, just to add one thing on top of this, and this is really a topic that David is an expert in. When we look to our approach as of public health, our society is focused in on treatment over prevention.
Always.
And what we're talking about here is trying to change that mindset, because waiting to say, oh, if I get a case of COVID, it's not going to be so bad. Well, that's a gamble that I personally wouldn't be willing to take. It's going to be a very dangerous disease. It can be completely unpredictable and can have extremely long-term consequences. But our society is, oh, if I get sick, I'll get a monoclonal antibody infusion versus for a few $1,000 versus a rapid test, which is soon going to be under $1. That's the target. So it's our approach as a society, and we're not going to change that today. David has studied his entire career in this process, but that's the mindset we're working with. We need to change that. We need to have a shift of being proactive and looking to prevent diseases and outcomes rather than wait for them to happen. And I wish I had an answer for that other than we can take charge here. And we can do things safely, as David was speaking about. And as this Convention Bureau is looking to focus, is that how we can do things safely so we can get back to business.
And Kavin, let's go back to the testing too, because, you know, folks may not appreciate, and again, we're not endorsing any single company, but there's lots of different approaches. I think there's two major ones. Let me try to, you know, lay it out for folks. So there are some companies that will do everything. Provide the staff, that's pretty expensive, provide the antigen test, the upload capability, put it all online, give you feedback in 15 minutes on a per person basis. That's sort of like, if you would, the gold standard of testing. There are firms kind of in the middle that will say, you all go get your own test, but we have an online platform and we're going to double check that you did it right. And we're going to upload the results so that everybody has the same look and feel as to whether they're positive or negative. And then there's a third group that just basically keeps a record and they don't care which test you use. And it's a little bit more, you know, open-ended. So, and of course, they vary in expense, you know, from most expensive to least expensive, depending on which of the three basic types you go for. I'm not endorsing any one of these. I'm only saying it's part of the slices of Swiss cheese. For big organizations that want to come to our great city, look, if they're able to provide that resource for peace of mind for their attendees, go for it. Fantastic. I think it would be, I know I would value it, but the key still is vaccination and having a way to demonstrate that everybody who's attending your meeting has in fact been vaccinated, and coming to a city where we have a high vaccination rate and we don't have pockets of vulnerable folks who are not vaccinated. Look, in healthcare, because we have 5 academic medical centers and we're under a mandate to get everybody vaccinated, we're going to be in a much better place even this time next month, right? In October, it's either, vaccinate or the highway. So I think that's great. It took us a long time, lots of issues here for different time to chat about, but we're doing it. And I think that's, we're setting a good example, as are some of our major corporate citizens and employers who are demanding, you want to come to the office, you got to be vaccinated. You want to stay home and work? Okay. But if you come into the office, you better be vaccinated. That's helping everybody else too. So I think we have a city we could be proud of because we're trying so hard in every conceivable way. Municipal workers, healthcare workers, school teachers, everybody's got to vaccinate and mask up.
And I agree. It seems like 3 or 4 months ago, we were at a much different point where companies are feeling very confident about requiring it. And I think economically, which unfortunately comes down to a lot of what happens in this world we live in. But I think the economics of people being vaccinated and feeling safe traveling is really starting to drive the discussion now.
Yes.
And that's important, I guess, where we are. We've got lots of parents on this call, so let's switch gears and talk about, we've talked a little bit about it, but children under 12 being vaccinated. We recently lost a convention called the American Academy of Pediatricians they were due to come next month because they were concerned, obviously, of taking themselves into a different city and then going back to their patients, most who are unvaccinated. So we understand. But Dr. Friedland, give us the update on where we are with children under 12 getting vaccinated.
Yeah, thanks. So actually there's news as of this morning. So there are 3 vaccines that are now available in the United States to prevent COVID-19. We refer to them by their manufacturers' names, which is really unusual, but the Pfizer, Moderna, and the J&J. And Pfizer submitted, they announced this morning that they submitted their data in support of licensure for children between the ages of 5 and 11. They submitted those data to the FDA as of this morning. So they're now under review. And if things go well, I would think it's possible that there'll be at least one of the COVID vaccines authorized for use in children between 5 and 11 by Halloween, is my estimate. So by the end of October. So it's happening. These were well-designed clinical trials with close to 6,000 5 to 11-year-olds enrolled, following safety out for a number of months. And looking at the immune responses, which appear to be on the same order, if not even more robust, as seen in older adolescents and younger adults. And so it's very encouraging. And then to follow that, there's ongoing studies with children between under age 5 all the way down to 6 months of age. And so, and those data will be coming later in October, is my understanding. So we're heading in the right direction. But here we are today. And so we absolutely need to make sure that our population is vaccinated at the most highest level, because our children are still susceptible. There's no vaccine yet available. And even when Halloween comes, it'll take some time to get those children vaccinated. So we don't want to let down our guard waiting for a pediatric vaccination, but it's on its way, which is great news. Great to hear.
So there's been a lot of talk over the past many weeks, and last week, a lot of discussion about booster shots. And, there seemed to be some confusion late last week when the CDC director overruled a panel about the necessity for a booster. So Len, talk to us about, first off, you mentioned that we really shouldn't be calling it a booster. It's more of a third shot or something. Tell us more about that.
Yeah, so thanks. So many vaccines that are used in our populations for adolescents and adults have a last dose of the series many months after the first dose. So for example, hepatitis A vaccination, it's a 2-dose vaccine where the second dose is given 6 months after the first dose. Hepatitis B vaccination. One of them is a 3-dose vaccine where the last dose, the third dose, is given 6 months after the first dose. For people over the age of 50 who've had your shingles vaccination, you get that second dose between 2 and 6 months after the first dose. And for all of us who have adolescent children, when they receive their human papillomavirus vaccine, they receive that last dose 6 months after the first dose. And so what happened with COVID? There was a public health emergency. It was absolutely critical to get vaccines available as soon as possible and to provide protection very, very quickly. So they were studied with the second dose, those mRNA vaccines. The second dose was given within weeks after the first dose, 3 or 4 weeks. But what we've learned over time is that indeed, to provide longer term ultimate protection that will last for months, if not hopefully years, we need to have a last dose at least 6 months after the first dose. And it's not to say that the vaccines the way we've been using them are not providing protection against hospitalizations and death. They absolutely are. But we are starting to see some mild cases of disease occur, so-called asymptomatic, these breakthrough cases, which will occur. And we believe we can control for that and continue to provide long-term protection against hospitalizations and death with a last dose 6 months after the first dose. So you could call it a booster dose. I like to call it a third dose in the series. The key is that who's recommended. And so over time, Kavin, it's absolutely clear to me that that third dose, that booster dose, will be recommended for everybody who's had their primary series. It's going to take a little time to get there. There's adequate supply. Right now, the Pfizer company has submitted their data. That's what's FDA licensed. Moderna is coming within probably just a few weeks. And once that happens, it'll be opened up to everybody. Right now, the recommendation is for people over 65, for people on the front line in healthcare settings, for example, people with underlying medical conditions as well are recommended to get that extra dose. So speak to your healthcare provider, speak to your pharmacist, speak to your doctor, speak to your employee health department around that. But within a few weeks, we'll all have the opportunity to get that third dose who've had the mRNA vaccines. And that's great news because the goal here is to provide long-term protection against hospitalizations and death. And that's where, and by having that extra dose there, that appears to be the way that the vaccines will be used in the future.
Len is so great, Kavin, and he explains it so well. I just want to reinforce we really shouldn't have to call it a booster. We should call it completing the vaccination series, but okay, I get it. Len gets it. I don't care if you call it banana. Let's get that third shot. And that's really, really important. Speaking as somebody who's Medicare eligible, my wife and I, we went and got our boosters just as soon as we understood what the issues were. And where does this information come from? Look, I know this must sound so confusing to people. And Len and I do this every day, all day, and it's still sometimes so complicated. And somebody overrules somebody else. And who are all these so-called experts? You want to tear your hair out. But we're learning from other countries that have much better data capabilities than we do. For example, the little country of Israel, 9 million people. Well, that's just New York City. But they're all on one electronic medical record. They literally almost can press a button and do a study. That's why they're able to say to us, hey, wait a minute, this Delta thing, that's pretty serious back on July 14th when they briefed Rochelle Walensky in person. And then they could say, hey, guess what? That third shot really seems to be working pretty well. And hey, pockets of unvaccinated people in various cities within Israel were still the reservoir causing all kinds of problems. So there are other nations that have certain capabilities that we don't. The United Kingdom has amazing genetic evaluation techniques. We don't have that on a national level. So we're learning, and science is messy. It doesn't happen overnight yet. We have to read the stuff, study it, talk to our colleagues and our peers around the world. Fortunately, we have amazing technology to do all this. So very quickly, we start to understand that Delta was causing these so-called breakthrough infections. And now we've got the opportunity here for the third shot or the booster. It's going to make a huge difference. And I think that's why organizations like the Modeling Hub and many others are saying if we get the kids vaccinated, especially those under 12, that will really reduce the reservoir of unvaccinated folks. And I'm very hopeful that this will lead to, turning the corner, let's call it March or in April of 22.
Yeah, so just one thing to add on top of this. So David, I think you hit it on the button. We're still learning. And let's remember that this all started in our consciousness in March of 2020. So it's only been, not even 2 years. So we're still learning. But as we learn, we also need to remember, and this is really important, if you haven't been vaccinated, we need to say to the members of our organizations who are going to come to a city like Philadelphia, get vaccinated, because that's how we're going to control this. That's the most critical thing, because it's, as I said earlier, we have a pandemic of the unvaccinated right here in the United States.
Exactly.
So moving on, winter's approaching and flu season's coming. A couple questions there. Are we more likely to see a higher case or another uptick, another surge with the winter and cold weather coming across the country? And a second point, more technical, concerns about getting the flu shot and maybe your third shot or your booster shot, whatever we want, whatever we want to call it on that.
Right.
Yeah, David, you mind if I start on this one?
No, go for it. Sure.
So influenza and COVID-19 are both respiratory viruses, and respiratory viruses in the Northern Hemisphere tend to circulate in the late fall, winter, and early spring. Last year, we did not have an uptick of influenza really anywhere in the world because of social distancing and people wearing a mask and also not going out if they were sick. Everybody stayed home. We don't know what will happen with influenza this year. Thus far, influenza rates are really quite low here in the United States, but it is a concern. Now's the time to get influenza vaccination. If you haven't been vaccinated yet, October is really the month to get it to happen. Influenza vaccines and COVID-19 vaccines can be given at the same time, at the same visit. There are data available to show that this is safe and effective. But it's also important to remember that during the pandemic, many people didn't go and get routine medical care. They weren't going to their internist or their family doctor or even to the pharmacist to ask about the other vaccines that are recommended for adults, for example, pneumococcal vaccination, pertussis vaccination, shingles vaccination, for adolescents, meningococcal vaccination, HPV vaccination. And so all of those vaccines can be given at the same time as a COVID vaccine. That is the recommendation. So we don't want to miss the opportunity. That's the take-home message. Don't miss the opportunity. When you're going in to get your COVID vaccine, when you're going to go get your third dose, or if you've never been vaccinated, that you're going to do it, ask about the other vaccines that are recommended, because we want to keep people healthy. In the winter, we all know how we can get sick, and we don't want to get flu on top of COVID or pneumococcal pneumonia. Now's the time to do it. It can all be given at the same time. In the future, we anticipate there'll be combination vaccines with influenza, with COVID, perhaps with something called respiratory syncytial virus even there in the future, but they're not here today. So we can hope for the future with less injections, but today we need to get different ones. But I think it's critically important that we keep ourselves as healthy as possible. And I want to introduce a concept, David, you might like this term, immune fitness. Vaccination is part of being immune fit so that we can live healthy lives.
Right. Well, I certainly agree with everything Len said. Look, it's so easy to get a flu shot. I mean, that's just, and we're all used to it. And let's also remember historically, it's been at least 10 years that our health system at Jefferson mandated flu shots for every doctor and nurse. If you didn't get one, you could not make rounds, you couldn't see patients. So the whole idea of a mandate, this is not a new thing. We've been dealing with this for years. And the flu shot is easy. Also, of course, last year, this time, kids were not in school, so they weren't exposed to other kids. And that's a big part of the flu season, especially from a pediatrician perspective. They didn't know what was going on. Last year, nobody had the flu. I think we're going to see it'll be a little different story if we don't get on top of this right now. So for grown-ups, Everybody get that flu shot. It's so easy to do and it doesn't hurt, and there's hardly any side effects. And you could get it, as Len noted, when you're getting your third shot for COVID or any of the shots for COVID. They could coexist with no issue.
Absolutely, absolutely. Kevin, can I address something that came up in the Q&A because it's sort of related? It has to do with the vaccine being rushed and the type of research that was done. So just to bring to everybody's attention that the virus that causes COVID is a cousin of the virus that caused SARS back in 2003, and then the MERS pandemic as well. And so the knowledge of those related coronaviruses allowed scientists to understand that that spike protein was the target for a vaccine. And built on top of that was about 2 decades of research with mRNA platforms and vector platforms, in particular from researchers right here at the University of Pennsylvania. And so building on this translational research over decades and then knowledge from SARS and MERS, that's how we were able to quickly bring a vaccine to clinical trials. And then the reason that we was able to conclude so quickly was there were so many cases of COVID that the trials were able to finish very, very quickly, faster than anybody would have anticipated. Normally, it can take 2-3 years to do these efficacy studies. This was able to conclude in months because there were so many cases. And so when we had the data and this unprecedented partnership between industry and our public sector and prioritization, that's how we got here so fast. But we don't want there to be public health emergencies, but that's how we were able to respond.
Right.
It makes so much sense. And the way you're able to break that down is fascinating. I wish you would be on some of our 24-hour talk shows, whatever spectrum you're on, because I think you break through pretty damn simply to make things so reasonable for us. I guess we've got about 15 minutes left, 10 minutes left. So I wanted to kind of wrap up and do some final thoughts. One of our general managers we had dinner with last night, and he asked the question, which was a great question. He said, we hear about herd immunity and there never seems to be an end. We're almost done. Delta comes up. Bonnie mentioned this morning, there might be another variant out there. Are we ever going to be done to a point? I mean, we know that it'll always be living, just like the flu the flu is out there, the COVID will be out there, but to a point of our community and our daily lives, do you think there'll be that's the end point, but a point where we get back to normal?
Well, why don't I take a shot at that first? Yeah, by everything that I can assess by the experts all over the world, this will become, background music, endemic, however you like to describe it, and we will live with it. And we'll get the boosters or the third shot. I think the other thing, which we've alluded to, there's research for pills that could be effective in addition to the current therapy of monoclonal antibodies. Our armamentarium will continue to improve because of all the great research and science and medicine that's going on. To say that we'll be completely rid of it, probably not realistic. Probably not. Let's remember, pre-pandemic, we had 60,000+ deaths a year from the flu. Totally preventable, most likely if they had gotten vaccinated. I think part of the challenge, Kavin, is the numbers make people crazy. Let's just take a moment to frame it up, right? So in 1918, 1919, 1 out of 150 Americans died from the flu, right? From the Spanish flu. Unbelievable. We've got 1 in 500. But still, for people, it's hard to get your head around that. 680,000 deaths. Imagine if one airplane crashed and killed 200 people. We would shut every airport in America. We would trace every nut and bolt from that engine and that failed plane, and it would be an unbelievable disaster. What about that collapse of that building in Miami Beach? Horrible, horrible for those families. It was front page news for 4 days. Well, that same day, 2,000 people died of COVID. So you got to try to get your head around, what do the numbers mean? The numbers, 1 out of 500 Americans dead from COVID, means you got to get vaccinated. I mean, it just is unbelievable to guys like Len and me and all of our colleagues, both in this city and around the country and around the world, it's incredible. We have the tools at our disposal to crush this thing. And politics aside, it's all about, to me, it's about patriotism, and it's about community and caring about my fellow citizens. So getting vaccinated and wearing a mask, that makes me a patriot, and it makes me care. And that's evidence of my caring, and Len's and yours and everybody else's. So you have to understand the numbers. The numbers are confusing. I get it. But when you take a step back and you look at what we've been through, incredible. 680,000 Americans. That's a staggering number. It's amazing to me that we're still talking about vaccine reluctance and vaccine hesitancy. Get with it, people. And for the leaders who are on the call with us, you guys and gals are in a really important position to influence behavior for your members, for your meeting attendees, for your families. You guys have a lot of power and influence. I hope you'll use it. I think that's really the most important public health message for our time together.
I also think we're at a point now, 18 months in, economically. You mentioned Israel. Len, I think you mentioned last week, you talked to a friend who was here for a while, went back to Italy.
Yes.
They're living life normally. I think as a country, not necessarily as a city, but as a country, we risk losing our competitive advantage in the world economic stage if we are lagging behind and international travelers don't want to come here.
Totally right. Well, look, we are sadly, from an epidemiologic perspective, one of the most dangerous countries as it relates to COVID to be in right now in the developed world. That's a sad statement. I see one of the questions is from one of our multinational potential guest companies. Look, as Len totally understands, we're never going to crush this until we crush it everywhere, right? And America, whatever your politics, look, we're donating hundreds of millions of doses. We're doing everything possible. But look, it's a complicated world. I don't see our adversarial nations doing what we're doing. They have vaccines that are not nearly as efficacious as ours. The details of Sputnik still are not available for scientists to evaluate. We could go on and on. But we're really a global community. We're all not going to be safe until we're all safe. That's how it is. So that's why we got to set the standard, show the world what a great democracy can do, and be a model for the rest of the world. Italy, the Scandinavian countries, UK, Israel, it's amazing. They had a slow start, the EU, and now, boy, you're a lot better off being in Italy, where, just to put it in perspective, you want to have a fantastic cup of Italian espresso and sit outside, you still have to show your iPhone and your vaccination status. Otherwise, no service.
Yeah, just to add one or two things on top of this discussion. Of course, there's a lot of opportunity ahead from what we can tackle through science, developing vaccines that could work mucosally in the nose, in the respiratory tract, rather than needing to be given intramuscularly. That is a way to actually stop transmission. So that work is happening. The availability of antivirals and other therapies that can be taken as a pill when somebody starts to feel a little bit sick would be a game changer. All that hopefully will come. But what we still have right now are these about 30% of people in America are not vaccinated. And I think, Kavin, you mentioned earlier, and David did as well, that we're a heterogeneous society. And those people will travel and they will come to where our conventions are and et cetera. And that is the risk. And so we can control what happens as far as public health in Philadelphia, but we can't control who comes into our city. And that's why it's so important that we all work together to not make the rest of us potentially at risk, because there will always be vulnerable people in our communities. That is given. And so it really is not just about us, it's about the health of those around us. And that's something that is really important as leaders of our organizations to say, let's do this for the betterment. Let's do it so we can all get back to, you said, are we going to get back to normal? We will get back to normal. We're already heading there right now. but we have still some work to do. And I think we all play a role in that to make sure that we can do it well. We can't count on others to do it for us. We have to help others as well.
You know, we've moved the bar so far down that line, but that last 30% is going to be the hardest, right? Because of their beliefs and their, whether it be political or religious or whatever. But it's alarming and it's concerning because, as you stated, that the science we've gathered over the years that we're able to implement based on this is amazing. The technology with having your iPhone be able to be used in a quick fashion in some countries, yet the question becomes, do we have the political will or the leadership of civic organizations, political organizations to really push it through even further? That's going to be the key for us. And that's where it might be our detriment, unfortunately. Final thoughts. We can't leave on a note like that. We've learned about Swiss cheese, bananas. What else? Len, I'll give it to you to start, maybe a minute to finish. Your final thoughts as we wrap up here.
Well, I'm encouraged by where we are today, but discouraged at the same time. We're seeing that. I took an Uber today to where I am right now, and 6, 7, 8 months ago, I would have thought twice about doing that. So we're moving in the right direction. I saw on Instagram pictures of the convention that you mentioned at the convention center over this past weekend, and we were looking at that, and we were looking, are people wearing masks? And you could see that there was business happening. So it's very encouraging how we're moving, but at the same time, I know that we have to not let our guard down. We need to get the unvaccinated vaccinated. We need to improve upon the schedules of our vaccines. We need to have these vaccines available for younger children. We need to make sure that our hospital systems can manage everything that comes through because there are other things that happen. But as a society, I think I'm encouraged, but discouraged. But what makes me encouraged is that as leaders of our organizations, we have the way to influence our members. And if we all lead by example, I think we're going to be heading in a better place than where we were. And this is life. Life is messy, but we want to make sure that we can conduct business and go about what we're doing. And that's why I love having the opportunity to speak to everybody today and work with this Convention Bureau, because we're trying to be proactive in helping you address your needs and do the work that we need to do. So that's an encouraging thing from my standpoint.
David, what about you?
Great. I never get the last word at home, Kavin. So thanks so much. So look, I have 2 observations, and I'm just so grateful for my colleague, Len. I have 2 observations. Let's say Halloween and Thanksgiving. Here we go. For Halloween, for kids under 12, keep that social distancing. Do not have a Halloween party at your house. Do not have a sleepover. You could still walk around the neighborhood, in the apartment building, on the street, wherever you are. Keep it outside and keep it safe and socially distanced. That is going to be really important. And I'm already thinking about Thanksgiving, my favorite holiday. Everybody's got to be vaccinated. And if you have the wherewithal to do an antigen test, either right before you travel or right before you get to grandma and grandpa's house, I would add that final slice of Swiss cheese into the Thanksgiving plan and get the test now so you'll have it ready to go when you're ready to be with your family. And that's a big advance over where we were last Thanksgiving. So as Len said, I'm hopeful, but we got to stick to the science. And for all the leaders who are on the call with us, thanks for joining us. And I hope you'll lead by great example and get out there and talk about it and provide education to the folks who still aren't on board.
Well, thank you both. You're both tremendous assets to Philadelphia. Can't thank you enough for all you do for our Convention Bureau and all of our stakeholders. So thanks to you two. Thanks to all of you for joining us today. We will post a recap of today's discussion if you'd like to share it with your colleagues. So check back with discoverphl.com for more information to come. But again, thank you all for your time. And Len and David, you are the best. Thank you so much. All right.
Bye,
have a good day,
everybody.
everybody. Take care.